was at a patient's house, and I had a family member there that said that they had used a different hospice for another family member and told me that they used the Macy Catheter. And I was like, what's that? And, they explained it to me. So I was a little intrigued and offended at the same time that they had something that we didn't. And I'm a little competitive, so it sparked my interest. There was more concern about how we would talk to the families about it. The seasoned nurses were afraid of change and learning something new. So that's kind of where the resistance came. It addressed the specific barriers that we were facing. It also provided education needed on how to overcome the challenges that we faced from the team so we could successfully get the team on board and begin using it regularly. At that point, we had a plan for a second meeting with the team. Everyone met in small groups. Thanks to COVID, we just did several different small groups on a couple of different days. We provided the hands-on materials, like the catheter kit, and let people play with it and showed them how to work it. It helped alleviate their fears. We also watched a lot of your videos of success stories, and the nurses were able to better relate to what they were hearing. That's what we do in hospice. We want to palliate people, and so they just, I think that's kind of what intrigued them and drew them in. I really think the manager training helped us set it up the way we needed to. It's been very successful. It has kept patients from needing to be placed on our inpatient unit. We've been able to manage their symptoms better, more successfully at home. It's also decreased our PRN visits and phone calls. It has given opportunity to provide continuous care for teaching. So it's just overall improved our entire department. I have gotten just that sense of relief. They're like, it's a wow moment when, I had a lady that had been up for over 24 hours and was combative, and I finally convinced her and letting me put her in bed so that I could change her, and I just slipped it in and she was asleep within like 20 minutes. The only thing I've heard from them is that their pain is managed like that. Just, it's a sense of relief, and, their whole facial expression changes, when they're comfortable. It's pretty amazing. I think it's given us something to be proud of. The staff feels more empowered. There's really no greater feeling a nurse can have than the feeling they get knowing that they've provided the greatest level of palliation for their patients. I would say, because I am one of those seasoned nurses, but I'm not afraid of change. I would say to think outside the box and give it a try. Don't knock it till you try it, like they say. But that would be my advice, is to don't resist until after you've tried it. Try it and then form your opinion.